friend. Dr. Brook here with another episode of Your Body Speaks. Today, we are going to be talking all about supplements and whether they are boosting your health or draining your energy. Supplements are everywhere these days, promising better health, boundless energy, and even the fountain of youth. But are they truly delivering on these promises? We are going to get into that a lot today. But first, let's recap episode 5, where I shared with you 3 of the mysteries of the body. First one being pain greater at night, or if you're feeling sick, you'll feel those sick, icky symptoms a lot stronger in the evening. I talked about fevers for both adults and childhood fevers, and I talked about why you get constipated when you travel. So if you haven't heard that episode, finish out this one and bounce over there to check out the information there. I went through a lot of detail on why that happens and what your body is doing when those occur. All right, are the pills you are popping helping or harming you? Today, we are diving into the hidden dangers of supplementation and how it can really impact your energy and overall health. Why does this matter? Because we're often told that supplements are the key to better health and vitality, but is this always true? The risks of blindly following this advice versus doing what is unique to your body's needs and desires is drastically different. Before I get into that, I want to define what oversupplementation is and what that looks like. So often people will tell me, or patients will share with me, that they don't believe that they are oversupplementing because they're taking just a few different things. I would disagree. Even taking a few different things at the wrong doses can be oversupplementation. It can actually even show up as undersupplementation. Maybe you're not taking enough of something that you need. But oversupplementation actually is a slow slide from black to white or white to black, that gray area that people fall into, where they listen to a podcast, they heard a well-meaning, educated person speaking about some supplement or some fountain of youth, as I was saying earlier in the episode, and they felt that they needed to get it. So they got a bottle, no biggie. Then they went to a Christmas party or a friend's birthday party, and somebody said something about something else, so they bought it. And then something else happened and they got something else. And this happened and they got something else. And that happened and they got something else. And before they know it, they've got a shelf full of supplements that they are kind of just taking willy-nilly. Wake up one morning, feel like popping that. Wake up the next morning, feel like popping that. Maybe I'll take 2 or 3 of these. Might need that. And everything is just kind of done with this intention of, well, I must be supporting my body. I'm doing something for it. These are all good for me, right? And that's not how it works. No, oversupplementation can be defined in the terms that I just shared with you, as well as somebody who's taking supplements that it takes them 30 minutes throughout a day. So maybe 15 minutes in their morning, 15 minutes in their evening to just consume, to get all those down. You know, they've got their little pill bowl and they're popping it, eating a bite, popping it, eating a bite, doing all these things to try to get these supplements down. And is that really, really, really good for you? Some of these common myths that people fall into in today's society and how they end up as that person with countless supplements on their counters, in their cupboards, everywhere they are, is that they've fallen into the crafty marketing campaigns, by well-meaning professionals, well-meaning health advocates, well-meaning people that believe that you are missing X nutrient. And if you just had their miracle drug, that you would be seeing all sorts of results that you've been looking for. The other thing that we have going for us is that our friends and our family they're well-meaning. They mean no harm, but something that worked for them does not mean that it may work for you. So this is how we fall into these traps. We don't recognize we're getting there until we're there. And I've lived that very personal story. This is how I know this because I am a person who went down the health rabbit hole from a person who wasn't taking any supplements, who wasn't eating a healthy diet or doing any of that, living a very conventional life, to taking every supplement under the sun, everything that I thought that I needed, consuming, putting on my skin, doing all the stuff, only to recognize that none of it was actually providing any sort of benefit to me and actually was having a lot of contraindications inside of me. So when I really got fine-tuned and really dialed everything back down, I ended up with two different supplements at doses that were much different than what I was taking. So this is really what I want to talk about is what is this doing to our body? How is this impacting us in ways? Because I know a lot of people listening to this right now. I know maybe you listening to this, you're thinking about people in your world, in your environment that might be doing this that you want to say, I want to share this episode with them. But what is this doing to our bodies? Because it is not having negative effects. I know that was a double negative, but it is not having negative effects in your body. It is having negative effects in your body. And whether it is a major effect and you notice symptoms of something right away, or if it's these minor effects, which happen more often than not, where you don't notice things happening right on the surface. Oh, I popped two or three of these and nothing happened, but two or three of these over the course of time is now causing problems and you don't know how to isolate it because maybe it's the kale salad you had for lunch earlier that day. We don't pinpoint things correctly back to the place because the body is so intelligent at times it will literally self-correct itself. So if you over supplemented in that one moment, it self-corrected. It was able to move past that. But over supplementing, like supplementing incorrectly, is going to cause more problems later on. And it's going to be a buildup to the point where you get to a point where you're like, hey, I ate a kale salad for lunch and that's what I think my body's reacting to. No, it's reacting to the fact that it's had all this stuff in its system for so long and had to deal with and no longer has the resources to do so. I want to get into the impact on energy and mitochondria and what these supplements can do to our bodies. So before I start this whole transition into this, I do want to spend some time explaining mitochondria and what they are. So, if we think of mitochondria as the energy factors of the body, these are the guys that produce energy throughout your body. This is when you eat food, that food gets broken down into components that allow your body to be energized. Think of a battery on your phone. When you plug that charger into the phone begins to charge. When we eat food, when we take in nutrients through food, we're not taking nutrients through supplements. When we're taking in nutrients through food, we're helping energize our body. The things in our body that do not have mitochondria, because every single cell in the body has mitochondria, these energy factors in it. The only cell in the body that does not have this energy factory in it is the red blood cells. Every other cell in the body has mitochondria. So mentioned earlier, as you're eating food, they're getting broken down into smaller components and they're moved through a cycle to create this energy. The largest energy producer in the cell is called your electron transport chain. Now, I'm not going to go all biochemy here, but I think it is important to note that the ETC, electron transport chain for short, is what produces the energy for the body to work, for your brain to compute, for your liver to detox, for your gastrointestinal system to be able to break down the nutrients for you to repair, for your heart to beat, for the lungs to breathe, for the lymphatic system to clear, for the kidneys to regulate blood pressure. You catch my drift? This is so vitally important for your entire function of your body behind the scenes. And this electron transport chain lives inside of this mitochondria and is vital to all life force. So how does improper supplementation disrupt mitochondrial function? Well, for one, it overloads your detox pathways. So you put a lot of pressure on your liver, on your kidneys, on the whole gastrointestinal system to metabolize a supplement that you're taking too much of, or one that your body doesn't need or want at all. So how does these pathways even run? Well, these pathways run from the energy created by the mitochondria. Not only are you depleting your limited energy reserve by doing this, you can cause mitochondrial dysfunction or worse, actual destruction of the mitochondria through too high of oxidative stress. Well, what is oxidative stress, Dr. Brooke? Glad you asked. Oxidative stress is your body's cleaning crew, the antioxidants. You may have heard that word, antioxidants. This is high in antioxidants, something that you'll hear promoted at acai bowl or acai smoothie places, acai high in antioxidants. So that's the body's cleanup crew. If that cleanup crew gets overwhelmed by too much trash, AKA free radicals, then it begins to damage tissue. Then it begins to create this cascade factor of tissue damage in your body, aging process quicker, lot more inflammation, lot more pain, and so forth. And the cycle continues because when you got inflammation and a lot of pain and a lot of destruction, you don't have healthy mitochondrial supply. So then your body is kind of working from a system of lack. We don't want oxidative stress in our body. We don't want to deplete our mitochondria. We want our energy to be running at levels that it should so that our body can do what it's been designed to do. So we're inundated with environmental toxins, we're inundated with stress, poor sleep habits, and poor diets at times. I know my listeners, I know you, you're more holistically minded. So I'm talking more on those times when we may not be eating what we normally eat. It's more like a 80-20 rule. So the times that we're doing the 20%, if we're not good in the 80 with all of our bodily functions, that can cause issues. If we drink a lot of alcohol, if we have a sedentary lifestyle, working at a desk and not exercising often, all of these things cause oxidative stress and are something that I know you and I are very vigilant about avoiding. So why let improper supplementation be the thing that gets your mitochondria damaged? If you're doing all the right diets and you're exercising and you're prioritizing sleep and you're doing all of these things, don't let something that you believe is working for you or that is beneficial to you because you heard a biohacker or somebody talking to you about supplements, don't let that be the thing that damages your mitochondria because you're just taking things, quote unquote, willy-nilly. So what can improper supplementation cause? Yes, talked about mitochondrial dysfunction and oxidative stress, but supplements do not work in isolation. They do interact with one another, and improper dosing can throw your nutrient balance off kilter. So for instance, too much iron can deplete zinc, which is a mineral that's important for your immune and metabolic function. But then too much zinc can also lower copper levels, leading to symptoms like fatigue, weakness, or impaired immune response. And then too much copper can cause oxidative stress and neurological balances. Isn't it interesting how those three are so linked together? For instance, if we take too much iron and we're trying to fix the zinc deficiency from the too much iron, so we take too much zinc, well, then what happens? We then have an copper issue. So it's like too much of this, too much of this, too much of this, leading to each other, like leading to issues within each other, and the ill cycle continues. These imbalances can create a domino effect where one nutrient deficiency leads to dysfunction among multiple different systems in the body. So I want to talk right now about some popular supplements that can cause harmful effects in the body when taken in excess. So some of these popular ones, vitamin D, for example, So, yes, a lot of us are living life, especially in the United States, with low vitamin D levels. And it is recommended with low vitamin D levels to supplement with vitamin D. But be sure if you are doing that, and I don't mean to get off on a tangent right now at all, if you have lab work and you see your vitamin D level is low, do not just take vitamin D by itself. You need to take vitamin D or vitamin K2 with it. Vitamin K2 and D3 are best friends. K2 actually gets D into the tissues and where it needs to be so that your body can actually utilize it and it's not just floating around the bloodstream. Now, I'm back on track after my slight digression right there. So, vitamin D. Well, if you take too much vitamin D and your levels become toxic, it can lead to a calcium buildup in the bloodstream because vitamin D does release calcium in certain amounts. This actually can potentially cause kidney failure and digestive issues and even cardiovascular problems. Is that something you want? No, not something you want. So make sure vitamin D, if you are taking it, you are taking it because you see lab numbers or you're working with a health professional or you're working with me and we've put a unique plan together for you. Vitamin A is another one. It can accumulate in your liver and it can cause headaches, it can cause dizziness, it can cause nausea, and it can cause liver damage. The other thing is vitamin C. We think about vitamin C all the time, especially during sick season. I think it goes without saying that most people have taken vitamin C in their lives. And vitamin C, especially in a synthetic form, can cause gastrointestinal dysfunction. So you'll have diarrhea, cramping, stuff like that, and it can lead to kidney stones. So although it's supportive, yes, to the immune system, if you're not taking it correctly, the right amounts, the right form, all of those things, you can be causing more issues in your body. Another issue about improper supplementation is the prolonged use of them without monitoring. So these people that have been taking things for years on end, like a certain probiotic, just years on end, the same probiotic, even months on end, I would say, months on end, the same thing over a long period without adjusting based on changing needs. So let's say your vitamin D levels were low. You're just taking vitamin D, taking vitamin D, taking vitamin D, and you're not adjusting that based on that number increasing with new lab work or working with me, then that can lead to a general buildup of oxidative damage, that oxidative stress that we talked about, where the antioxidants aren't coming in to clean up and you have more trash buildup. The issue with that is that the body cannot effectively metabolize these things, can't effectively break them down into the components that they actually need and be able to excrete the excess. So then you just have a toxic buildup of them in your bodies and your liver and your kidneys and your gastrointestinal tract, and everything gets backed up and all the way up to the top. So body loves diversity. And so taking any supplement for any length of time is not good. You want to be shifting probiotic strands ever so often. So if you're taking probiotics, you're shifting strands, you're doing things appropriately to your body. So nothing I'm sharing here is meant to invoke fear. If you've listened to prior episodes, you know that I am a person who's about operating from a state of faith that your body is healing, that it is doing exactly what it's intended to do, that you're working to support it in the best way possible, and that fear is only going to create a cascade of more symptoms, more problems, more everything in a negative way. So when I'm sharing this about supplements and how too much zinc or too much iron and too much zinc and too much copper, just those three, and what too much vitamin D and vitamin C and vitamin A can do in your body, using those examples, it's not intended to make you feel fearful and go, oh my gosh, what am I? But more to really help you create a meaningful way of learning to love your body, learning to really dialogue with it, learning to discover what it needs, and learning to discover how it's communicating with you. So, as I've been saying through all of these episodes, building that deeper connection with this body is the most tangible gift that God has given you. And you will begin to learn its cues and its wants when you begin to put some of this stuff into practice that I've shared in prior episodes. So, the best rule of thumb to follow here when it comes to supplementation is to not do it at all if you don't know what to do, or if you feel like you're starting to fall into the trap of a marketing campaign of a well-meaning professional telling you something on a podcast that's speaking to a general audience and not to you directly, or a friend or a family member tells you this weight loss drug worked for them, or that worked for them to sleep better, or this did that for their diarrhea symptoms. If all of this information is coming from anything external and not from somebody you're working with uniquely, or not from your own development of the cues that your body is giving, then don't do it at all. I hope that makes sense. Do not do supplementation at all if you don't have the deep awareness of what your body is communicating with you, if you aren't working with a professional, if you're listening to podcasts and having people share that with you. Don't do supplementation at all in those regards, okay? It's better at that point not to do anything and really get your nutrients from your diet in this case. The reason I say all this is because you are unique. Your genetics, your environment, your past and present lifestyle choices, they all play a factor in the whole picture of what your health expression looks like. So instead of getting caught up in the waves of a pill for this and a cream for that, it's time to focus on the things that I know you, again, as a holistic minded person, already focuses on, which are the whole food diets with lots of protein and veggies, reducing your stress, minimizing exposure to toxins, drinking water and limiting alcohol consumptions, prioritizing sleep. That is the greatest thing you can do to help heal your body, is to really prioritize sleep routine if you can't get all of these pieces in line. And then leave the supplementing on the table for now. Because bottom line, supplements can be more harmful than beneficial. That's what I'm getting here through this episode, more harmful than beneficial. So if your skills are developing, as I mentioned just a few moments ago, if your skills are developing and listening to your body, put those skills into practice. That is something I am always going to recommend, and I'm always going to say, is constantly be practicing with yourself. Tune in to your body, ask questions. Do I want this? Do you want that? Do you want to go here? Do you want to go there? You'll start to pick up cues that the body is giving you in this case. So if you are listening, developing this practice and listening to your body, put that into practice. When you see a marketing campaign for the next hot drug on the market that's going to give you the fountain of youth and do all the stuff that you're looking for, ask your body, is this something that's supportive to us right now? Is this something that we need? If the answer is no, don't buy it. Of course. If the answer is yes, then begin to drill down further in asking questions. Okay, well, then how much of it do I need? Do I need one pill twice a day? Do I need two pills twice a day? Do I need to take one pill once a day, or one pill at 7 a.m. and another at 3 p.m.? Getting very specific on breaking down those questions. And I know I gave a lot of questions really quick. But the more you deduce down that question tree as you're developing this skill, the better you will get at being able to fine tune. So if it says two pills twice a day, then you ask the question, okay, it doesn't matter what time I take the first dose and the second dose. If it doesn't matter, then morning and evening, right? Very general. If it does matter, then it will tell you a specific time. If you do, however, receive a response, let's say the response is you need 6 pills 3 times a day, that is not the right supplement for you. It may be the right nutrient. Say, let's just say, for instance, it is vitamin C. So it may be the right vitamin C, but maybe it's like a low amount of vitamin C, like 200 milligrams. So when you're asking a question about that specific one, your body's asking for a high dose of it. That is it's not that it's bad information, it's not the best information. So in that case, when you get those kind of responses back, you need to really be thinking, how do I I need to find something that is a higher dose per pill, so you're not having to take 6 3 times a day or whatever. That is a very high dose of vitamin C, so definitely don't recommend, even at 500 milligrams of vitamin C, 6 pills 3 times a day. That's wild. If you don't feel comfortable in your ability of really fine tuning and asking the intelligence of your body, yet, that is okay. That is okay. Continue to practice. And I can help you craft a unique supplement plan that is right for you. If you're working with another health professional that is getting you on a plan that's right for you, that's also great too. Stay with that, stay focused on that plan, and do what you need to do. Proper supplements in the right doses can unlock health in ways you've never known. So it's important. I tie the bow on all of that to say it's important, yes, to have certain supplements based on what your body is actually asking for, because it can actually unlock health in ways that you've never experienced before and help you get jump started. Does not mean you're staying on things long term. It just means that we're utilizing supplements that are right for your body. I want to share a very brief but impactful story with you right now. I was working with a patient who had seen another practitioner for some other really chronic health conditions that she was facing. And she was given a protocol of supplements to take based on this issue that she was trying to resolve. And she'd get good and get going for a couple months and things would be fine. And then after those couple months, everything would fall to pieces. She would start her period and then all of the same symptoms were returning and everything was coming back. And she calls me, she reaches out to me and is sharing this story with me or telling me what's going on, and she's frustrated and she's angry and she's at her wit's end. And she essentially decides to work with me. Now, a piece of the story I failed to mention is she had a consultation call with me and then decided to work with this practitioner. So she had a call with me, decided to work with the other practitioner. So it had been a couple months since I talked to her. And now she's back having a conversation with me and sharing what the last 3 months have looked like. And she's been at practitioner after practitioner after practitioner. And so we get through a couple wellness plans or a couple of protocols for her, and she's starting to experience some major shifts in her body, major changes going on. And I remember one of the questions she asked me is like why am I having changes with you, and why didn't I have changes with him? I just don't understand. And he was running her through thousands of dollars worth of lab work. He was doing all the stuff, checking for all the imbalances, which is all great work. But there are other things that the body is needing to be helped with, or the body needs support in other ways other than supplements, and other than or in other ways other than nutrients. So sometimes that shows up as neurolymphatic points and different things that she needs to do. So when she asked this question, it was so interesting to me because analogies are my thing. They just kind of come flying out of my mouth and just drop into my mind. Thank you, Jesus. So quickly. And in this moment, as she's asking this question, the one thing that I thought of to really anchor this in for her was this: that when a baby is crying and it's hungry and it's starving and it wants mama milk, a caregiver or a dad who doesn't have access to be able to feed the baby in that moment, or something's going on, what we tend to do is we put a pacifier in its mouth. So if it can get that sucking reflex going, it feels like it's getting fed, so it feels like it's getting what it needs to stop crying, right? And the crying stops for maybe a few minutes until the intelligence of the baby realizes, oh my gosh, this is not a bottle, or this is not mama breast. like I need actual sustenance. So it spits out that pacifier and it begins the crying and the ask for that need to be resolved. And so I'm telling her this and I'm sharing that analogy with her. And I said, that's exactly what's going on. I said, you had all these labs, you had all this work done, and everything was getting addressed by all these nutrient deficiencies, and all that you were taking all these supplements, but really it wasn't like what your body was prioritizing. Your body was not prioritizing that specific thing. It was prioritizing this over here. And when we started to go after what the body was prioritizing, we actually started getting results, and we're still continuing to get results. I don't mean to be like speaking in past tense terms, but this is so incredible watching her body just completely come back into harmony and balance and doing its thing after living decades of chronicity of all kinds of problems, because we finally are giving it what it's actually wanting. So I know I said that was a brief story, but I think it's so powerful in just communicating the fact that it's important to do what your body wants, not taking supplements willy-nilly, not doing things just because somebody else told you that it worked for them, but really fine-tuning and figuring out what works for you. Of course, I'm really passionate about this topic. I hope that actually came through in this because I was trying to be a little bit more mellower than my yelling, don't freak out like I did last episode. If you haven't checked that out. Thank you so much for sharing this time with me. I just want to honor you for spending the time to empower yourself in learning these different things about how supplements aren't always the answer to anything. And it's actually best to be avoided in the case when you don't know what to take, rather than to just take things and end up like the person I spoke about earlier in the episode. So I just want to honor and applaud you for that and let you know that next episode, we are going to be talking about sleep and diving into the science of it and how to maximize its benefits. Because sleep is by far, if someone was to ask me, what is the one thing that every single person on the planet, patient, non-patient, can do for better health, and that is to sleep. So vitally important. And we're going to be talking about that on episode number 7. Until then, have a beautiful rest of your day, and I will talk to you then.